Hi, how are you? In today's stream, we'll be discussing about the adult cardiac arrest and how to approach these questions in USMLE exams. Not only in USMLE but also in real life when you encounter the patient with cardiac arrest. First of all, you have to understand that how the patient with cardiac arrest presents. Most of the times, these patients have no pulse, so we have to start the CPR right away. We start with the CPR, we start with maintaining the airway and breathing and circulation. And when we start the CPR, obviously someone in the ER would attach the cardiac monitor and ventricular defibrillator. On the cardiac monitor, you first of all you have to understand what sort of cardiac activity is seen in the patient. Either it is pulseless electrical activity or it's ventricular fibrillation or ventricular tachycardia. Pulseless electrical activity is basically the organized cardiac rhythm may be AFib in the presence of no pulse, no palpable pulse. So organized cardiac rhythm in the absence of pulse is pulseless electrical activity. If there is pulseless electrical activity, you won't give the defibrillatory shock. You just have to continue the CPR. You have to give epinephrine every 2 to 3 minutes. You have to maintain the IV access, you have to maintain the airway access, and you have to every 2 to 3 minutes you have to obviously give the breath to the patient, and you have to determine whether the pulse has returned or not. Meanwhile, you are doing the CPR. You have to rule out or find the causes of the cardiac arrest. The easy way to remember these are 5 H's and 5 T's. It could be hypovolemia, it could be hypothermia, it could be hypoxia, it could be acidosis, hydrogen it could be, yeah, it and five. So, and what are the 5 T's? It could be pneumothorax, it could be thrombus, it could be cardiac tamponade, it could be toxins like benzodiazepine, it could be morphine, it could be trauma. So rule out the causes of the cardiac arrest, which has caused the pulseless electrical activity or VFib or VT. Remove the causes and continue the CPR. If the patient has ventricular fibrillation or ventricular tachycardia, you have to first you must know how the ECG of ventricular fibrillation and ventricular tachycardia basically presents. And if you find these two, then you have to give the defibrillatory shock and then start the CPR. So the management for both is different. If it is pulseless electrical activity, you have to continue the CPR. You have to rule out the causes of the cardiac arrest. If it is ventricular fibrillation, it could or ventricular tachycardia, then you have to give defibrillatory shock and then continue the CPR. So this is a basic difference that you have to remember. Either you are attempting the USMLE question or uh, you are doing the duty in ER. So I think this is enough for today. Yeah, thank you.